Hey gang, Anne Marie here. Welcome back to the channel. And today I want to talk to you about what happens whenever someone says your loved one needs long-term care. Does that mean a nursing home? What does that mean? So the first thing you need to know is long-term care. If you get that topic from someone, it usually means that your loved one is in the SNF. They're in skilled nursing, which is in the same building as long-term care, same building as a nursing home, but they're there because they fell and broke a hip or they had a surgery or whatever, and they had this rehab that Medicare paid for. And then at the end of that time, let's say that they were already 95 years old and struggling, or their stroke knocked them down so far they truly need nursing care round the clock indefinitely. That's what long-term care means. And so in most people's minds, long-term care immediately says nursing home, and that's fine. You know, at a nursing home, you have nurses there all the time, and you have caregivers there all the time that are certified nurses aides. And most people, if you are a two-person transfer, they'll tell you, or they need a Hoyer lift, which is a thing where they put them in the strappy thing and move them somewhere. You know, if they're that fragile, if they have Foley catheters, if they have, you know, big medical stuff going on where they truly need someone medical like that 24/7, you know, a nursing home or long-term care may be your best bet. But there are other things that you can consider as well. And sometimes you can go into residential care. In a residential care home, I think we've talked about them before, that's where you're in a house, in a neighborhood, just like anyone else, but in that house, they have caregivers 24/7, and you usually share the house with 3 to 6, maybe on the outside, 8 other residents. I really like them because if you're looking at the difference between a nursing home and residential care, you know, in residential care, that care ratio is like, you know, 1 to 3, 1 to 6. Whereas in a nursing home, that ratio per caregiver, per nurse's aide is more like 1 to 15, or maybe in the issues we're having now with staffing after COVID, you know, you may even be looking at 1 to 20 or more. And that's something you need to know and think about. You know, in a residential care home, they can still get all of those things. There are licensed places where they can do that. They're not all the same though, so we're going to do another video just about residential care. But for long-term care, you're usually thinking nursing home, which if they're in rehab is probably where they're sitting now, but you don't have to stay in that one. If you want to move them to another one, you can totally do that. So you're not stuck there, but you do need that kind of care when someone talks to you about long-term 24-hour nursing care. Now, some people that need that can even do assisted living. Assisted living, there's lots of assisted living, different kinds, and what they'll accept and what they won't. And so you can even find places like that that have an even better caregiver ratio than the nursing home. And they get to have their own things in their own apartment, and it just feels a little more comfortable. It just depends on what they have going on. But don't think just because mama needs help getting from her chair to stand up that she needs a nursing home. That's not true. So you're looking for someone who's telling you in a nursing scenario already, you know, hey, they're not progressing enough, they're not doing this enough to go home, or even to maybe an assisted living, but they can do these things, and that's what that means. So I hope you have a good day. Help us spread the word so we can help as many people as we can figure out this senior living journey. Until then, I'll talk to you soon.